We've explained where on 3 types of specialist palliative care provision, that is the provision of inpatient units, mainly hospices, sometimes in hospitals, the provision of hospital support teams who work across entire hospitals to deliver palliative care where it's needed, and the provision of home care teams delivering palliative care to people in their own places of residence. We've shown that on each of those dimensions, Scotland is in the top 10 of European Union countries. It's doing extremely well. So the information deficit has been addressed to some extent. We now got a sense of where we sit in relation to the other countries of the EU. But it's also given us a bit of a pointer to where things could be improved, because where we're doing best is on the provision of the hospital support teams, then on the provision of inpatient units, and then on the provision of home care services for palliative care delivery. We looked at 2 things. How many services are being provided in each of these categories per million of population? But we also looked at what the European Association for Palliative Care recommends as its guideline for the optimal level of provision. And that really is the crucial thing to look at here, because when we looked at the home care provision, we found that it was 72% of the optimal. So there's room for improvement there, perhaps quite significant improvement by further investment and attention to what we know the Scottish Government is very committed to, which is care for people in their own homes. In the other 2 areas we're doing pretty well, but we're still sitting below that 100% optimal figure. There are some countries that have a figure above 100%, so in a sense they're over-providing certain types of service against the European guideline. Scotland doesn't over-provide anything. It's providing at a high level that gets it into the top 10 countries on every one of the 3 categories we looked at. But in each case, it's below the optimal level, and it's particularly so on the home care teams.